Well, the Health Minister, Dr. Zweli Mkhize, has expressed concern about an email from Johnson & Johnson saying the pharmaceutical company won't sign off on delivering 20 million doses here until the Trade and Industry Department confirms support for its investment in Aspen. That's just one of the matters he brought up this morning in his update to Parliament's Portfolio Committee on Health. At the same time, of course, there was that decision last night by the Department to pause the rollout of the Johnson & Johnson vaccine. Let's speak now to the Chair of Parliament's Health Portfolio Committee, Dr. Sibongiseni Dlomo. Dr. Dlomo, good evening to you, and thank you for joining us once again on The Pulse. The decision last night by government to actually pause the rollout of the Johnson & Johnson vaccine, do you think it was the right decision?
That is one of the questions that was posed by one of my committee members. And then this was what Dr. Zweli explained. And some of us understood. Yes, out of almost 6 million US citizens, only about 6 have actually been affected by what appears to be like a thrombosis now. That they are indicating to us as a precautionary measure. As soon as he finished briefing us, he said, look, I'm going to be meeting the experts because it's FDA, it's SAPRA, and all the scientists in the country are looking into the report that comes from the US. What is the causality of this? It's something that probably must be attended to. But in our thinking, and in his explanation, it's something that's not going to be very long. It shouldn't be more than 2 or 3 days before they come to a decision. So we like to call it a pause rather than to a complete withdrawal of a J&J.
I mean, as you say, we're talking about a very small number of people. I mean, I've got to tell you, I've seen doctors really argue about this, you know, because it would seem such a small risk. At the same time, of course, we're vaccinating adults, which is something we don't do that often. It's quite a complex thing. The real problem comes if there's no new data with which to make a decision by, say, the end of the week. That's actually when it becomes more stressful, doesn't it?
Yeah, no, but we all supported him that we're caution, but we don't think it will take that long to really make up our minds. Look, the results are quite clear. It's about young women between less than age 50, probably the women at the reproductive age. It is something to do with the estrogen. They want to go and check if it was related to a recent delivery, a recent pregnancy, or something like that. So they should come quickly to a finding, which will then allow us to really continue with the rollout. That is why the minister, this is going to impact on the rollout overall plans. No, I really don't think so. It may just be an issue of 2-3 days that we are not really moving forward. But as we are preparing for a massive rollout of the society, by that time we should really not have a challenge. So we think it's, in fact, one statement that actually he reads from the experts in the country say, please do not ignore the FDA findings. We just cannot ignore that it didn't exist. However, being cautious is something that we need to work on it within the next few days and come back to our system as is. We cannot, as scientists, allow just to ignore that fact. Yes, it is a minor finding, but it is significant. There has been a loss of life.
I suppose, Dr. Dlomo, you can imagine the outcry if the Americans paused it and we didn't. I mean, I can just imagine the conversation we'll be having there. I do want to ask you, I mean, there are a whole lot of details that are beginning to come through about, I mean, I call them details. Sometimes they're pretty big details about the rollout. One of them is around Johnson & Johnson wanting to make sure there's proper investment in the Aspen factory where those Johnson & Johnson vaccine doses will actually be produced in Gqeberha. Do you believe that you have been given all the details that you need? I mean, some of them are also about the very complicated issue of legal liability. Do you believe, as a portfolio committee, you're actually getting the details that you need? Some of the contracts aren't being made public.
Look, for the first time today, because I had written to the minister as a chairperson, and the minister acknowledged that the letter that I wrote is almost like putting a parliamentary question that he must answer truthfully and with honesty. So he was very candid in his actually replies, and other members even commended that part. We are beginning to actually find the things that are happening behind the curtains, of which he was actually available to say to us, look, we have been constrained to release these things to yourselves because of the non-disclosure agreements that we have with these companies. But now that we have put it clearly as a parliamentary question, the way you have written it in the letter, we are bound to explain to them that, look, we are having an oversight over us, and we cannot not answer the questions of the chairperson and the portfolio committee. So he was very clear in actually answering some of and giving us details, how much they've paid for this, that one, what agreements are they putting on them, what are the things that our negotiators who are legal are actually not agreeing to. So today was actually quite a revealing meeting amongst all of us.
I do appreciate the time. Dr. Mkhize, thanks very much indeed, the Chair of Parliament's Portfolio Committee on Health.